The radiologist is looking for specific damage, deterioration, and disruption on x-rays and MRIs because the focus is primarily on symptom management rather than addressing underlying structural issues. Chiropractors specialize in examining the spine for these subtle misalignments through their multiple assessments and hands-on techniques, which usually leads to a stronger identification of these alignment issues. Once identified, specific chiropractic adjustments are the primary method used to correct spinal misalignments. These gentle and precise movements, manipulations, they help restore proper alignment and movement to the vertebra, relieving pressure on the nerves and facilitating optimal nerve function.